Want to work in the healthcare field but don't want to sacrifice over a decade to become a physician? No worries. Today I'm going over more than 20 different career options for you to choose from. So if you're interested, stay tuned. Hey, mentee, it's Dr. Norte, your favorite medical mentor. And today we're going over different career options in the healthcare field besides being a physician. And I know I'm a physician, but I also understand that not everyone wants to take that route. So today we're going over different options. There's so many different players on the team, and I need us to fill in all of the spots. So we're going to take a deep dive today, and I want you to see where you fit in so that you can go ahead and pursue those dreams. Before we get started, don't forget to like, share, and subscribe. And don't forget to share this with all of your friends so that you can have a bestie in every department in the hospital, okay? And also, don't forget to sign up for our monthly newsletter. There's so much juice in the newsletter, and I don't want you to miss out. I want you to be a part of the MKN family. So don't hesitate. Go ahead and sign up right now. If you're ready, like Freddie, let's jump in. Lego. So I'm going to break the different careers into 5 major buckets. And then you can see, based on your personality, interests, etc., where you truly fit in or what career may interest you. So we're going to jump right into the first one, which is direct patient care. And just like the name states, this is for my people that want to be face to face with their patients and their family, really hands on. So if you have a bubbly personality and you like talking with people, this may be a great bucket for you. So let's go over some careers that may be right up your alley. There's a lot of different careers in this bucket, so just stay with me. The first one is nursing. And with nursing alone, there's levels to it. So you have your certified nurse assistant, CNAs, then you have your licensed practical nurses, LPNs, then you have your registered nurses, RNs, then you also have your nurse practitioners, NPs, then you have your nurse anesthetists, which would be CRNAs, and then you also have nurses that work on the admin side or more in a non-clinical role. So each level takes a different amount of training, different amount of schooling and requirements. So depending on your interest would depend on how long you would be in school for. But a lot of the nursing careers are direct patient care. So this may be an amazing option for you. The next one is physician assistant or PA. This may be a great option for you. It's about 2 years of training after your bachelor's degree, and you can go into all of the various specialties, and you have the opportunity to switch specialties after working. So you may start off in peds and do that for a few years and then decide, oh, I want to go into ortho and do that. So this is a great option that allows you to also have flexibility and also gain some expertise in certain fields. The next one is a pharmacist. So if you want to know everything about the drugs, this may be a great career path for you. Some careers are patient facing, and I know there are some careers that are non-patient facing, but this may be a great way for you to get connected within your community at your local CVS, Walgreens, Walmart, different dispensaries for medication and really get to educate patients on their medications, and then also, of course, do the behind the scenes work as well. The next one is dentistry. So, if you want to make sure everyone in the community has a bright, white, straight smile, this may be a great field for you. We definitely need more amazing dentists in the community. It's really hard to find a great dentist. I have a great dentist, but I know it takes a while for many people to get great dental care. So this may be a great field for you if you are interested in working, with the teeth, with the mouth. This may be for you. The next one is physical therapy. So, physical therapists make sure that your overall function is at its optimal peak. This can be after an injury, after a different illnesses. They may work with you to make sure that your range of motion is where it should be, give you great tips on how to stretch, and just really stay mobile after injury, illness, or just for overall wellness. As a physical therapist, you can work in a hospital setting. You can also work in private outpatient offices as well. So if you're interested in the muscles and really working on range of motion with different patients, from children all the way to the elderly, this may be a great field for you. The next one is occupational therapy. And occupational therapists really work to make sure that you're able to do normal day-to-day activities to the best of your ability and as independently as possible. As an occupational therapist, you can work with children that may have some developmental delay, and then you can also work with the elderly or other patients that may be in rehab centers after a stroke or injury or different illnesses. So if that's something that interests you, this may be a career for you. The next one is speech language pathologists. They work on language, communication, and then swallowing. So they can also work with children and then also work with the elderly as well. Most of the time, they can work in rehab centers, schools, the hospital. This may be a great career if those things interest you. Next, we have respiratory therapists. These are the kings and queens of the vents. You can work in the ICU. You can also work in the emergency department, suctioning, giving breathing treatments to patients with asthma. You can also work in the neonatal ICU. Of course, I'm a pediatrician, so I'm giving pediatric locations. But if you are really interested in the respiratory system and the lungs, this may be a great career field for you. Last but not least, within this bucket of direct patient care is surgical technician. And surgical technicians can get a little bit of a bad rap among medical students because they do not play about keeping their sterile fields sterile. These are the people in the OR that help the surgeon perform the procedure. So they're giving them their different instruments. They're very knowledgeable about all the different instruments in the room, and they make sure that the sterile field remains sterile so that the patient decreases the chance of getting any infections, right? So if this is something that interests you, if you want to be in the OR, if you want to be a part of the action and assist surgeons, this may be a great field for you. You have a little bit of patient care because, of course, the patient has to come in, we have to sedate them and all of that. Most of the time they're asleep, but there is still some direct patient care.
I did want to submit 2 more careers into the direct patient care bucket: EMTs and paramedics. Both of these are pre-hospital emergency care careers. Paramedics do get more extensive training and can provide more advanced level care. However, these would be the people that arrive at a home or a scene to help you before you are transported to the hospital.
So the next bucket is diagnostic and technical careers. So if you're someone that wants some patient contact, but you also like to be behind the scenes, then this may be a good bucket for you. So, first on the list is a phlebotomist. So, these are the people in the hospital or at your local lab that draw blood. So, if this is something that interests you, if blood does not make you squeamish, this may be a good field for you. The second on the list is a lab technician. So, what a lab technician does is test and analyze the different samples, whether this be blood, urine, tissue samples. They are specialized in analyzing it within a machine under the microscope in order to get us the best test results, and that's reported to the physician and then to the patient. And they also ensure the quality and make sure that it does not become contaminated. The next one is a radiology technician. So with radiology, there's several different modalities and different machines that you can become experts in. So of course we have X-ray, then there's the CT scan, there's ultrasound, there's MRI, there's PET scan, there's interventional radiology. So there's different levels when it comes to radiology technicians. So you can really look deeper into which modality may fit you best and then further specialize in those subsections. So this may be a great field for you if you want to, speak with the patients as they're coming in to get their imaging done, but it's not as much as someone that's doing direct patient care. And last on this list within this particular bucket is a cardiovascular perfusionist. What is that, Dr. Norte? So these are the people in the OR or in the ICU that may run the bypass machine. And the bypass machine is basically when someone is having open heart surgery, they need to make sure that your body is still functioning. So basically, it's like a heart and lungs outside of your body to keep the blood flowing. And the same thing for an ECMO machine. Within the ICU, if your heart or your lungs is really sick, they're the people that manage the ECMO machine so that you continue to circulate the blood throughout your body correctly, even though your heart and lungs have halted for that moment. And hopefully, once you get better or the surgery is finished, then of course your organs will continue to do the job. So this is a very important job. It's very cool. It's very specialized and niche, but this may be something that interests you. And a lot of time nurses do this too, and they get further training on it, but there is also avenues for you to do it without necessarily becoming a nurse first. My third bucket is for my lifestyle and my wellness people. So the first career is a social worker. So really working on people with their mental health and some social issues that they may be dealing with. Of course, as a social worker, there are many different buckets that you can work in. Are you working more as a therapist? Are you working in the hospital, really dealing with social issues and trying to help the family navigate different barriers or challenges and coordinating things for them? There's different things that you can do with a social work degree. So that's something that you would need to look further into to see what truly interests you within the field. The second one within this bracket is a nutritionist or a dietitian. And with this, people can work with children, they can work with the elderly, really helping with weight loss or weight gain, making sure that people are getting the right foods. If they have certain illnesses, such as like celiac disease, making sure that you're eating a diet that is best for your body at the time. If you need to be on a keto diet because of seizures or different things like that, that you're helping family and patients with that information as well. So that is my lifestyle and wellness people. If those careers interest you, that may be something for you to think about. So, my fourth category or fourth bucket is specialized careers. So, the first on the list within this bucket is an optometrist. So, this is really the primary care physicians for the eyes. So, when you think about going to the eye doctor to get a new pair of glasses, these would be the specialists that do your yearly or biannual eye exam. So, if you're interested in vision and treating simple eye disorders, this may be a great field for you. The next field is audiology or an audiologist, and they are specialists for the ears. So they deal with hearing loss and then also testing hearing for babies when they are first born. So if you are interested in the ears, this may be a great option for you. The next one is a genetic counselor. A lot of different illnesses really are increased due to genetics. So a genetic counselor would walk a family through what that truly looks like, explain different risks to the family, do all the blood work with them, and really walk them through the whole process. So if this is something that interests you, you already know this may be a great field for you. And last but not least within this field is a veterinarian. So this is for all of my animal lovers. And this is animal on many different levels. I learned veterinarians take care of a lot of different types of animals. So if you are not scared, I'm a little scary. If you're not scared of animals and you really want to interact with them on a deeper level, be a physician for our friendly pets and also other different types of wildlife. This may be a great field for you. For my shy people or for my people that really don't want much clinical care, this last bucket may be for you. These are my non clinical careers. So the first one is health informatics. So this is really an emerging field, especially right now with AI development, technology. This is for you. So if you're a computer geek, if you want to know everything AI, EMR systems, this would be a great field for you. Also, data analysis as well. And then the last but not least is research. We need so many different PhDs in so many different sectors to really look deeper into cancer diagnoses, community research, bench research. There's so many different types of research that you can do. And if that is something that interests you, this may be a great field for you. All of these careers are amazing, but of course each of them take a different amount of time to complete. And I know as a student, because I used to be a student, you want to know, Dr. Norte, which career field takes the shortest amount of time to complete and which one makes the most amount of money. And of course we want to make sure that we are picking fields that will not burn us out, but we also need to make sure that we are picking career fields that we are passionate about and that we truly are invested in. So, while some fields like being a CNA or a certified nurse assistant may take a few months, doing something like getting your PhD or becoming a dentist may take upwards of 8 years. However, the 8 years will come and go anyway. So you might as well be doing something that you are truly passionate and fervent about. So make sure that when you're looking at these different career options that you are picking it off of interest and passion and purpose and alignment and not just time frame. Okay? So there you have it. That's over 20 different other career options besides being a physician that you can explore and look into. And that's really what this video is about. Just to open up your mind to other options that you may not have even heard of and never even thought of to explore. So I hope that this truly helps you on your journey. Even if you think you want to be a physician, look at the different options because you may be surprised. If you look at the different options and you figure out, no, none of those really fit me, I still want to be a physician, then that's awesome. That's even more reason why you know that you're on the right path. And if you look at some of the options and say, hey, I'd rather go this way, then that's great too, because you are doing exactly what you desire to do with your career going forward. I know some people are visual people like myself. So if you would like me to make a chart of the different career options that I've spoken about today, definitely let me know down in the comments. Of course, like always, don't forget to like, share, and subscribe. If you haven't already watched my last video on do's and don't at this year's SNMA conference in St. Louis, go ahead and do this right now before you head out next week to the conference. Alrighty, Minty. Bye bye.